Hello and welcome. This is the Blue 1 group presenting the Module 7 and 8 Power of 3 video on the current state of primary care and the Affordable Care Act, along with considerations under the new administration. I am Olivia Weippert, and my group consists of myself, Brotgandel, and Emily Hendry. Pay attention as we teach you about primary care and the ACA today. So, let's begin. Primary care is the first point of contact, or the entry point to healthcare. Primary care physicians can be called the gatekeepers because they are the people who refer patients to specialty care if needed. It can be distinguished from other types of healthcare by the duration, frequency, and intensity of the patient's care. Primary care is longitudinal, so primary care physicians are involved in the follow-up of patient care, usually for long periods of time. The focus in primary care is on the individual as a whole, unlike specialty care, which focuses on the specific disease an individual is being treated for. Because they are following up with the same individuals over a long period of time, they are also involved in coordination of care because of their characteristic of acting as gatekeepers. Lastly, primary care is considered essential because it is used to optimize the population's health. The Affordable Care Act, sometimes referred to as Obamacare, is a reform that was passed in March 2010 by the Obama administration. This reform was passed with the purpose of making healthcare more affordable and accessible to every part of the population. The first goal of the ACA is to make affordable health insurance available to more people. This goal is achieved by providing subsidies that lower costs for households with incomes between 100% and 400% of the federal poverty level. The second goal of the ACA is to expand the Medicaid program, allowing consumers with an income lower than 138% of the federal poverty line to receive benefits of this program. The final goal of the ACA is to support methods that will lower the costs of health care. Some of these include educating people about preventative measures and providing training and benefits to primary care physicians to increase primary care in general. The Affordable Care Act went through some significant provisions that caused an increase in premiums and deductibles in insurance. The first one of these provisions was young adults under the age of 26 are to be enrolled under the patient's insurance plans. This led to uninsurance among young adults declining by 5%. But did not lead to an increase in preventable care utilization among these young adults. The second provision made it illegal to charge more or refuse coverage for people who had pre-existing conditions. The effect of this was seen in increased premiums individuals in a group because of the high-cost individuals with pre-existing conditions. Third, an individual mandate was created that imposed a penalty tax on people who were not covered by health insurance. This was not effective because the penalty taxes were less expensive than the premiums for insurance, causing a decrease in incentive for people to purchase the insurance. All of these provisions had the overall effect of raising premiums and deductibles, especially for people that did not meet the ACA's tax subsidies. The ACA and its provisions had some major effects on primary care. The ACA increased Medicare and Medicaid payments to primary care providers, leading to an overwhelming increase in the uninsured patients to primary care professionals. The ACA also increased incentives for primary care professionals to work in underserved areas to serve populations that were previously lacking access to health care. In an attempt to increase the strength and volume of primary care available, there were expansions to the health center program and additional training programs were made available. Even with these changes made to the attempt to strengthen primary care, there continues to be a shortage in primary care because there was only temporarily increase in pay, and professionals may be overwhelmed by the large increase in insured patients from Medicare and Medicaid. The overall effect of ACA on primary care is that there has been an increased number of patients that have primary care coverage and access to health care, and a decrease in people who say they are lacking easy access to medicine, affordable health care, and a personal physician. There are still some gaps in primary care availability due to the surplus of insured patients and lack of primary care physicians. Despite the importance of primary care for controlling healthcare costs, primary care has several glaring limitations that will need to be resolved moving forward. One such issue is controversy within the field about which specialties should provide primary care, which overlap between internal medicine, family medicine, and pediatrics, causing tension. Physicians must look to better define the roles of each of these specialties to limit their overlap. Primary care also faces the challenge of not being the most attractive option for physicians. Future physicians are motivated by several factors when selecting a specialty, including the prestige and amount of reimbursement, lifestyle, and social prestige. Primary care has lagged behind other specialties in terms of the amount of reimbursement and has never experienced the prestige enjoyed by specialty care. The Affordable Care Act attempted to remedy part of this by ensuring reimbursement, albeit temporarily, and offering incentives such as loan forgiveness for physicians who choose to work in medically underserved areas. This issue can also be addressed by increasing the number of non-physician practitioners, also known as the NPPs, because they require less reimbursement than a primary care physician. Although the Affordable Care Act mostly succeeded in creating an influx of insured patients into the market, it has struggled to attract physicians to primary care to better serve these new patients. This inability to build a workplace capable of handling this influx of patients has resulted in a decrease in the quality of care seen by patients as physicians are overwhelmed. Part of the difficulty with creating a workforce of primary care physicians is the difficulty of attracting potential physicians to this specialty due to the lower rate of reimbursement and the received lack of prestige. The Affordable Care Act attempted to remedy this by temporarily increasing the reimbursement received by physicians for making and taking Medicare patients. Given the increasingly aging population and their greater need for health care, this was prudent, but it is unclear to many physicians if the increased rate will last through future administrations. This uncertainty has made some future physicians hesitant to commit to a career in a primary care. When Trump was entering office, a great deal of rhetoric was based around the complete repeal of the Affordable Care Act. After he took office, it began to be apparent that to get enough support for the repeal of the Affordable Care Act, the Trump administration would have to offer a replacement to gather enough support among legislators whose constituencies relied on the subsidies from the Affordable Care Act. This gave rise to the American Health Care Act that was passed in 2017. One change brought about by the American Health Care Act is the repeal of tax increases that were passed with the Affordable Care Act to pay the expansion to Medicaid. This was accompanied by the repeal of the individual mandate and limiting federal control in favor of giving more autonomy to the states and individuals. One of the largest changes is that individuals would now pay according to their own individual risk, instead of paying a rate that accommodated the influx of high-risk patients that entered the insurance pool following the passage of the Affordable Care Act. Although we have seen the flaws in the field of primary care and in the Affordable Care Act, neither is entirely bad. In the case of the Affordable Care Act, we have seen an influx of insured Americans and an increase in preventative care by removing out-of-pocket costs for cancer screening, contraceptives, and vaccination. These were both victories for preventative care and improved the overall wellness of the American public. The Affordable Care Act also helped to begin developing primary care by creating some more incentives for future physicians to enter primary care specialties. Primary care has also seen the development of several new ways of providing care. Patient-centered medical homes help bring professionals together to treat patients with a coordinated, team-based approach. Community-oriented primary care is another new direction taken by primary care that takes into account the biopsychosocial aspects of care, but thus far has stagnated in the U.S. due to issues with defining what a community really is, as well as a workforce shortages and a lack of financial incentives. And finally, I'm going to leave you with 2 discussion questions that will get you thinking about all of the things you just heard. So, number 1. How do you think that the considerations under the new administration will affect our number of insured and uninsured citizens in the future? Number 2, in what ways does the Affordable Care Act affect the limitations in primary care today, and how could this be solved better in the future? And finally, thank you all for tuning in. This concludes Blue One's presentation.